be able to connect with you. I know it's I don't know, we've connected on LinkedIn sort of inadvertently, but I've always been intrigued with some of your work on that patient communication and understanding sort of the sort of the do's and don'ts and what's some framework of what patients, how to empower them. And I've thought about my own journey, sort of navigating specialists and lots of physicians, and wondered if there were ways that I probably could have derailed the process in some of these one-off sort of meetings or visits. So I'm interested to hear about your background and also sort of how you've gotten into this and what you've learned. So,
Sure. Oh, great. Happy to be here, Caroline. Thank you for this discussion. So my background is I have a master's in healthcare administration, and it was something that I knew I wanted to do from a very early age, mainly because my father was in the health insurance field. He worked for a not-for-profit health insurer, and he just loved his job, and he came home excited every single day. And it was sort of the love for working and doing something to impact people's health care. And that really rubbed off on me. In fact, I even went to the University of Michigan for graduate school because he did an executive management program at the University of Michigan. And I live in New York. We lived in New York. And he came home so excited about the Michigan campus that I said, I want to go to school there. It sounds so great. He goes, well, not undergraduate. I have to be able to drive to where you're going to go to school, but if for graduate school. So that's how it worked out for me. But it's sort of funny to think that I sort of knew at 16 that this would be a very good path for me. I knew I wasn't inclined to be a doctor or a nurse or a psychologist or any real direct patient care service. I like to organize things, people, organizations for efficiency, for moving an issue forward. And it really carried through my entire career, being um, very minded about having organizations be better performers. And I've worked across the spectrum of different healthcare settings. I worked in hospitals. I worked for a hospital association. I worked for two consulting firms. And then my last position was an executive at a managed care company, which I helped start, Medicare and Medicaid managed care. So I really got a smattering of every
wow.
side of the healthcare equation, reimbursement systems, insurance systems, customer service systems, how to really help people navigate through the system. And
Hmm.
sort of what brings me to today is that about 6 years ago, my health crashed. I needed a stem cell transplant, and it was a very rough process and journey. I put off some sort of critical healthcare decisions I needed to make many years ago, but I was able to sort of live with my disease just being monitored. But then I got to a point where I couldn't. So I had to have the stem cell transplant because there was no other cure for my blood cancer disorder. And it was a little bit rocky at the beginning in terms of recovery, but it's been 6 years now. I feel really good. I'm on a good trajectory. Nothing's perfect, but I'm here to talk about it and to smile about it and to help other people. And about 2 years ago, I sort of woke up from the trauma of I had to leave my position suddenly, and then I also had to take care of myself and take care of my recovery. But when I woke up from that feeling, I feel stronger, my head is clearer. What can I do now? I knew I wasn't going to be able to go back to the full-time 24/7 responsibility that I had in my previous position, but what could I do to contribute? What have I learned both as a healthcare administrator and as a patient that I could bring to the fore? And where I really started to focus in on patient physician communication was that my hematologist oncologist told me that I was a very good patient. And I said, oh, that means my health, I'm doing well. And she goes, no, I don't mean that. What I mean is that you are very focused, you ask good questions, you follow up on all your, and I said, doesn't every patient do that? And she goes, no, they don't. And I thought, oh, there must be something to this. Maybe I know things from either being an executive and being a patient with a complex disease. Maybe I know something that other people, maybe this is the value that I can bring. So I ended up doing about a year's worth of research on the topic of patient-physician
Wow.
communication and really delved into many areas that, are just not that easily known by people. In addition, it's an extremely stressful process to be sick, and no one likes
Yes.
seeing doctors.
Right.
So,
Totally.
so who is really born being able to do this very easily? Maybe somebody in the healthcare field who maybe is a good, project manager. That's what you're doing. You're project managing your life, which you do. So
Hmm.
why not project manage your health for your own, well-being and your own longevity? And that's sort of where I come out, in the equation. I've been speaking and writing on the subject for about 2 years now, and the response has been just tremendous because the information is out there, but it's all over the place. Nobody is will buy. Can't go to Barnes and Noble and buy a book to explain how you communicate with a doctor. And when
Right.
you're really
Right.
sick, is that your first notion? Maybe your first notion, if you like AI, is go on AI and say, "This is what I'm feeling, and I have a doctor's appointment, and what should I be asking my doctor, and what else is out there, and what should I be thinking about?" And those
Hmm.
are all good things, and it's part of the process in terms of preparing and getting ready for this encounter with a doctor who maybe you'll have 15 minutes with. If it's a first time or an annual physical, maybe you'll have a half an hour with that doctor, but physician time is very scarce, and you have to make the best of that time, and you have to represent yourself, you have to use your voice, and you have to just sort of be prepared in advance to have the most productive conversation you can have in 15 minutes. And in fact, sort of these kinds of conversations that we're having right now is sort of like that. This is time limited, and we want to share certain information with people. What's the most critical things that people might want to know? So maybe I turn back to you. Like, what do you think that if you knew back then what you know now, because I know you know a lot more now about, how to communicate with doctors, what would be one thing you would say, I wish I would have known this
Well, I
15 years
think I think that the one of the questions that I've always pondered. So, I mean, with my veterinary training, I sort of started to track all my symptoms and develop my question list. And I think part of it, so I knew my story really well. And I think one of my questions is when, I remember one visit in particular where and so I knew the system. I knew that there were specialists. I knew that, not everybody has all the answers. But, I remember one appointment where I felt like so I put everything in a folder and I handed it to the physician. And I didn't know, I think one of the questions that I have for you is this, in retrospect, I feel like that maybe that was sort of overwhelming. Like, here's this 10-page summary of what I've been doing for the last X number of years. And that's going to be really hard to absorb and process through. If they're looking at their watch saying, I've got 15 minutes with this woman, how
ago.
am I going to look at this and look at them and decide what to do? That's a lot of pressure. So I'm interested in that that play between coming prepared but not feeling like, you don't want to put the physician back on their heels like, well, wait, they only have this amount of time, and adding to that pressure. So what's that threading that needle like? What's
Well, absolutely. You raise a lot of good points. So, the first thing I would say, and again, I know more now than I did years ago, and partly from my work and questions that people have asked me that I've had to think about. So, in the case of somebody that you haven't seen before, so it's a new doctor, and especially if they're not in the healthcare system that you've previously been working through. So, depending on the area where you live, a lot of healthcare goes through an academic medical center, depending
Mhm.
on how complex your disease is. And they all work with the same system and the same information. So, let's just take the doctor is in the system. If the
Okay.
doctor is in the system, you want to make sure all your vital information is in the system, tests or things. If you've done tests with other doctors outside the system, make sure that's you bring that with you. And so the doctor's new to you, even if they aren't, the doctor's new to you and really doesn't know you, and
Yep.
you think that, there's a lot you want to make sure gets included in like the health record, I would send them the information in advance
Okay.
of the appointment so they know you're a patient, because it's important for the doctors to know that you want to participate in your care, that you're prepared to do that. But like you
Yes.
said, you don't want to overwhelm them and you don't want to be leading this appointment. The patient should not be leading the appointment because doctors are trained for what's called the medical interview, to take it step by step, to go through the diagnostic process, to ask certain questions and go through it. And even if it's in the file, they want to see for themselves or ask for themselves. They want to hear how you're feeling now, not the history from 10 years ago. So I think there are a couple ways you can handle it. So if they don't know you, you can send it to them in advance, or you could come prepared just with a summary list, be really, and that's where the preparation comes. How can I summarize this
Right.
very well to, in a way, it's expediting this discussion because most of these doctors are pretty smart. And what I have found is they have great memory. So you tell them one thing and you meet with them again, they seem to remember it. I could never remember from
Mhm.
time to time because most things, the discussion isn't in the medical record. So you have to keep track of that discussion to make sure things, you follow up on things.
Yeah.
So I hope that answers
No,
your
it
question.
does because I think that what I like about it is too is that you put it down into a summary for a couple reasons. One is that then you've gotten the key points, you've gotten your the sort of that elevator speech, and you've been able to present it. And what went through my mind as you're describing that, Dana, is that then it takes for me, it takes that sort of desperation off of lessens the desperation from my standpoint. Like, oh my God, I'm so desperate to get help. And especially if it's been, the eighth or ninth specialist that you've gone to, you're starting to know that things are tricky. And I was aware that, chronic fatigue syndrome is not something that is, there's a direct test for. So I knew it was going to be tricky. But with each doctor, I could feel myself getting more desperate. And if I to back up a little bit and be able to write that summary, make sure everybody has it in them, and to respect their own process. Because I know that, you know, in veterinary school, it was always about get the history, start with the history. Don't, don't jump over that. Just because you feel like you've read this, you need to, as you
Mhm.
said, know how the patient is today. So you have to respect that physician process so that then they get going and then you're both being able to, even if it's a short period of time, you get into a natural rhythm. And I feel like sometimes I sort of stepped over that rhythm and interrupted that, which wasn't fair to them. And
Mhm.
it didn't work well. So I think that's really valuable. But I think, and what's when if you come with say 10 questions and you're at the end of it, is there sort of that in between or that sort of discussion of what you do at the end if you think, boy, I've still got some questions to ask. How do you navigate that when you're respecting time?
Yes, I think that's an important point because I think you should come to every appointment with what your agenda is, and the agenda might include not just questions, but to make what your priorities are, what you want to accomplish. And then also makes maybe some things you might have done research on. So you want to make sure you cover that. So,
Mhm.
and then your questions, making sure you do your highest priority questions first. And as you see things are going along, you need to say to the doctor, look, I respect your time. How can certain questions are important to me. How can I reach you in between appointments? I don't want to wait for the next appointment. Maybe I could either, some people come with the list of questions already and they could just hand it to the doctor on a piece of paper, or some people just ask the doctor directly, what's the best way of reaching you in between appointments? Is it by the portal? Is it by direct email? I know my hematologist oncologist gave me her cell phone number. She wants me to text her. That's because very fast paced. That's the way she's giving and receiving information on a continual basis. And, I always say, I don't want to bother you. I was sending you a text. She goes, nope, that's the way I like to receive information. So you need to like work with your doctor to see how they like to work with questions. Also, things you might not think about till after the appointment may come up. And you always want to ask the doctor that question. How can I communicate with you in between our appointments?
Well, I think that's, I'm really glad you described that because I know even today, I go to the portal and I've never asked my primary care now, like, what is your preference? And she may say something differently, but I've just inadvertently used the portal. But, in a couple of conferences I've been to, the portal is another way where physicians get overloaded and it's a tricky, clunky system and it may not be their preferred. So I think it's an excellent point to be able to know what their preference is. And they may even say, boy, I do like the portal and I'm going to give you, give me 24 hours, or something, some time limit to be able to respond as well. I think that would seem to be an important part of the give and take of this communication as
And
well.
And some doctors even say, look, call my office and leave a message and I'll call you back. And like sort of a primary care doctor theoretically should be doing that because they're
Mhm.
your baseline kinds of issues, like a reaction to a medication. You want to let your doctor know really right away. So you
Yep.
call their office directly to get them and let them know. And maybe a nurse will call you back, but maybe the doctor will call you back because if you're a complicated case, I know I have a really fantastic primary care physician who's also a geriatrician. And
Mhm.
so he works very well with hematology oncology, so that really able to come together so that I feel like I'm covered from both sides because,
Mhm.
the aging process coupled with a complex illness. And
Yes.
aging process doesn't only start after 65. So I like to tell audiences that. So depending on the complexity of your diseases or your history, it may be starting at 45 or 50, not at 65 kind of thing, right? But geriatricians are in very short supply in this country, which is really not a great thing because they add so much value to older people in dealing with the impact of aging on one's health. And it's really important to have like somebody well-rounded to be able to deal with these issues, not just say, oh, I'm going to go to my endocrinologist for my, hormone and my osteoporosis, and then I'm going to go to there are even dermatologists today that specialize in older populations. So I
Wow.
think those are important things to consider too. And I know we both had on our mind how much we juggle with specialists and how important specialists are, but you don't get the same opportunity to develop a relationship with a specialist unless, you have a chronic condition that's going to be like a lifelong thing
Yep.
in a way, like I have and like you have, that you want those specialists to you want to have a close relationship with those specialists. But most specialists is very transactional, and I'm
Right.
not sure how much relationship. So the best thing to do when you're meeting a specialist for the first time is certainly to let the specialist know, who you are, your voice, how you're interested in participating in your care. You want to do it in partnership. This is what I've tried. This is what's worked. This is what hasn't worked. And how important really that medication management is, because every specialist, if they're not all in the same system paying attention to your meds, you as the patient need to bring that up and say, okay, you're introducing a new medication, can you just look at this list and see if there's any contraindications with this new medication? I know I do that all the time, and there are actually a couple of free websites that you could do that as a patient too, to double check, but don't just rely on your own checking. You can ask a pharmacist, you can ask your internal medicine or primary care or the specialist to do that check for you.
Well, that's a great point because luckily I'm not on a lot of prescriptions, but you start to then when they add up, you really want to have that be an immediate, like, not even start the conversation of trying something that is going to be contraindicated. So having that list with you is really important. That makes a lot of sense. And I like the fact that you're looking at the relationship with primary care physician and specialist a little bit differently. I mean, depending on the complexity of your illness, but they are more specialists are potentially more transactional, as you, that's a great word, just to be able to say, we're going to cover this, and then you hopefully go back to your primary, and they're going to be sort of that hub. And so a couple things that you mentioned. One was uh, you don't necessarily want to start this when you're ill. So do you have so recommendations of, while you're healthy, sort of get into good practice. So are there, is that just with, you just get started with your general wellness every annual? Started with your annual? Is that what that cadence?
Yes. Yes. So part of my journey was learning about all the mistakes that I made when I was in my 30s and 40s. Really incredible when I look back. So everybody needs to have a primary care physician. And when you're, a child and your parents brings you to a pediatrician, and then that might stop at 18 or maybe 21. And then you're in a student health system. And then, depending on whether your parents are still involved in your life or you're going to be independent, it's really important to have an annual physical examination,
Mhm.
because you want to have that baseline. And you also want to know, what you should be looking out for, what you should care about, what the doctor has seen. I mean, um, the statistics show like a growing amount of obviously cancers and gastrointestinal and heart conditions of younger people getting younger and younger, suffering from these diseases. And it starts early, and it could start in your 20s and in your 30s. So the
Yeah,
mistake I made was when I really didn't have a primary care physician in my 20s, except for an OBGYN. And
right,
the
right,
OBGYN, then I had my two children, and it was my OBGYN. And I still didn't have a primary care physician. And then I was diagnosed with my blood cancer disorder. My hematologist said, okay, I think we need to get a little bit of advanced intervention, but you need someone helping coordinate your care. Do you have a primary care physician? And I said, no.
right.
And I was in my 40s and did
Yep,
not have a primary care physician. Now, so that really the preventive, this is part of a preventive program for yourself. So you can, whether it's, I'm learning more and more about functional medicine. I think it offers a lot of opportunities for people to pay attention to a lot of different aspects of their physical and mental wellness,
hmm,
through exercise and nutrition and relieving stress and all those things. And also, so thinking about those kinds of things when you're younger really sets you up also for really understanding what your body is doing and what your mind is doing as you
right.
go through your life. And so
Yeah,
that's very important. And now, I mean, 20 years ago, they didn't have the genetic tests that they have available now. If 20 years ago, if I would have known now what I knew then, I would have taken more. I held off on certain genetic tests. My mother passed away from breast cancer. Our sister had breast cancer. I just did not want to know if I had the breast cancer gene.
yeah,
I was just frozen about
yeah,
it. And it wasn't, I wanted to wait until my oldest was 18 because I knew I would be taking certain actions. If I had
right.
the gene, I would take certain prophylactic actions. And
Hmm.
I just wanted to wait until my oldest child was an adult, if anything happened to me, to be able to take care of his brother. And that was part of my mental equation,
Yep,
right, wrong, or indifferent. And
yep,
then I ended up having the genetic test, and I was BRCA negative, but I was genetically positive for the disease, the blood cancer disorder test that I had. But then more recently, like within the last 2 years, I had a full panel of genetic tests,
uh,
and it came out I was at normal risk for everything. But and now I'm encouraging friends, family members, the children of people that I know, the more you know, the more you just can be looking out for things. And part of it is figuring out how not to worry about it. So if you're at higher risk of certain things, the knowledge of how you deal with it, how you monitor it, and how you deal with it, I think is very soothing to the anxiety-ridden kind of thought process that goes along with, I don't want genetic testing because I don't want to know what could happen.
right. And I think it's such a valuable point because there is such, that whole area has grown, and now we have much more information and being able to not only get the knowledge, but then know what to do with it. and be able to then be prophylactic and use those earlier years to know what's higher on your, as you said, what are those risk pieces, so that then you just make some decisions. And it's really, for me it's my family. I have familial hypercholesterolemia, and now I'm suddenly like, okay, I finally am on a cholesterol lowering drug, but I needed a primary who then understood that with chronic fatigue, I'm pretty sensitive to drugs. I have a lot of bowel issues. I couldn't take oral statins, so we've had to navigate that. And having a primary who then could incorporate in my disease, as we talked about, as I age and as this cholesterol became a thing, I was like, okay, it's a thing now, and I need to address it. And but I think some testing back when I was in 40s would have validated that, yes, this is why my aunt had this, and those kind of things would have
Mhm.
made more sense.
Yes.
And I think the other thing that you brought up, which I'm also really fascinated, because you said, everybody has their own process, every clinic, um, and how do you work towards standardizing the information that you're trying to get across, so that patients are more informed over sort of more universally? How does that happen when things are chopped up a bit and every clinic has their own portal and all of this stuff? How do we start to get that? And what avenues have you felt that have been successful for you?
Well, my approach, because of the intensity of my recovery process, has been that I'm the CEO of my own health, and I have to own my own information, and I have to know what's in every single portal. And actually, I get care at two major academic medical centers who don't use the same system and don't talk to one another. So I'm
Mm.
the one who has to deliver it. Sometimes it's by email, fax, scan, get the disc, transfer it over, but making sure all my doctors have all my information about me. And just for me, it works having these two centers. Ideally, if you could work through one center and you have all your doctors, but I live in an area. Let's say I got my stem cell transplant in Manhattan, and I live on Long Island, and so it just
Yep.
was sort of a natural course that I had to do. But I'm not getting my regular care in Manhattan. I get sort of my day-to-day care, near where I live, but I make a lot of extra effort. So there's no there's I don't think anyone in the healthcare industry is optimistic about having a full-blown, coordinated health data system. It's been being talked about since I started in this field in 1983.
Hmm. Yep. Yep.
It's not happening.
Yep.
What ha Everything is much more insulated. Every system works on its own.
Yep.
There is a connecting piece, and I haven't quite figured it out yet. Those systems that use the same software platform, there's a
Yep.
couple popular ones, but one in particular that has the majority of academic medical centers in the country. There is a higher level integrator
Yep.
that theoretically doctors could go into and pull information out from other systems. But
Yep.
nobody has ever showed me. I've asked, I've tried to find information, but they don't readily give it to patients to be able to find that.
So
But then
instead,
again, it's up to each doctor to
right,
say, oh, it's up to the patient to say, I think you could, but really to expedite things for the doctor. So you have the doctor being focused. Your goal is to make the doctor's
right,
time the most productive and
right,
focused on you as possible. So the doctor is not really that interested in doing 10 extra steps to getting your medical records from
right,
that other place. And they have
right.
staff, but this is taking away from
Yes,
your one-to-one with the doctor saying, I have it for you. I own my own information. I might not understand everything, but I read the reports and I raise questions and I let the doctor know that they can rely on me to share what I think, what the patient thinks is important, which is
Yeah,
really a very big part of a physician-patient interaction. The physician wants you to know, wants you to share with the physician what's important to you, what
right,
matters to you, what your priorities are, what your goals are. Some people's goals, I want to be able to travel. So what road do you go down medically if in 6 months we want that person to be able to get on a plane and go somewhere without the feeling that they're going to have some emergency and how to deal with it, or help set this person up so they can go out every day to take a walk or go out somewhere or
right,
whatever it
right.
is. I mean,
Yeah,
it's people's life.
yes.
Everybody has their own way of structuring their life. Share that with the doctor. I think it's important. And I think it's important no matter how old you are. And this is sort of the point that I make, even though I had a chronic disease and it was complex and I had a stem cell transplant, everything that I've worked up about in a framework for people to communicate better with doctors applies as much to people who are well as to people who have chronic conditions, to people who have acute conditions, because we're all going to be a patient at one part of our lives. And so it's very important to know certain things that nobody really teaches you. And
Right.
that's, why I really feel like what I talk about has value to help people like be healthier and get what they want so they can, not have to worry so much about their health.
Well, you're establishing a great pattern for everybody. They get into a rhythm and a routine about their care that then is translates over time, and then they just build on it. But then you, as you said, it gives them security and that confidence and that reassurance that, hey, I'm doing what I can here. I'm knowledgeable, but and now is that what you're this thinking patient planner that I've seen you reference? Is that something that then people can then go to your website and download, or have access to, or is that something that you're working on?
I would say so um the goal of the planner is to be like a resource tool when I go to organizations or employers, healthcare organizations, physician practices, and say, I think it's a very important educational and knowledge building skills
Hmm.
to share with patients. And when you do that and all the important things that you can share this with your patients so that they can have an organized way to communicate with you and keep record of the visits and keep record more what the follow-up actions are, what they need
Right.
to think about, what they need to research, what they need to make an appointment. It all gets in one book. But, currently I'm selling it really like on an organization-wide basis
Okay,
and not
sure.
like a direct to
Yeah,
consumer.
no, but I think that's great. I mean, I think, right, because you're trying to be able to partner with these organizations, educate them, and then be able to target that. But I just wanted to make sure we
Yeah,
mentioned it because it's a valuable what you're producing and collecting, and then being able to make that as a resource, and that's good to be able to
thank you.
have available at that level. So, well,
I
I've
also I I also always say that, if you sort of um follow certain uh, processes. You don't necessarily need my planner or my guidebook. Like when I first started, I came up with the idea because I had a spiral bound notebook and I was keeping all my records for every single visit in this notebook so that all the papers were together. Yes, I had other papers that I got from the doctor, a report was separate, but I would keep, my engagement, my questions, the answers to my questions, and everything in this notebook.
yep,
So you don't really need, mine is really the guide to give people like organization and
yep,
focus.
yep,
And if you have that organization and focus, you could use a notebook of your choice. But what's interesting, what I found, because a lot of people, the younger people today, like to use, their notes on the phone, a notes app or this app. But writing things down by hand actually puts more into the brain. You know it, all more into the brain.
yes,
You remember things better. You're able to focus more on other things because you're writing it down and it becomes part of that repertoire and that flow for you. And
yes.
I learned that through my research as well. What are good methods for people? But I was on some Reddit threads learning about how people use notebooks or journals about journaling,
Yep.
their, let's say, headaches or other things. And there were a lot of young people in this group, but they were all buying journals and planners to help track,
Wow.
their headaches and time, place, what was happening, an expression of what they were feeling at the time, all those things. And here there was all these young people using a physical notebook
Good.
because it's really been proven. Just
Yes.
like people, everyone will, the big thing, we meditate and you journal every morning. It's all part of it. You put brain, hand,
Yes.
paper, it becomes like, part of your understanding of how you're
Yes.
feeling.
Right. Well, I totally agree with that. I love even paper books to be able to hold on to something, but I'm glad to know that other generations understand that. But I'm thrilled to be able to have this conversation, and I just a wealth of knowledge, and you're giving back in such a powerful way, Dana, and I'm just very impressed and thrilled to be able to have this conversation with you.